Welcome to Drugstore Dialogue. I'm Barry Newman, the pharmacist at Triborough Pharmacy, located in Astoria, Queens. Today we're going to talk about a popular topic currently in the news, injectable weight loss drugs. Welcome to Drugstore Dialogue, Dr. Chioma Okafor, family medicine and weight loss expert. Welcome, doctor.
Thank you, Barry. I'm happy to be here.
Dr. Okafor, where did you receive your medical training? And how long have you been in practice?
So I received my medical training in the Dominican Republic, and then I moved to the U.S. and did my residency at Indiana University School of Medicine, Family Medicine residency. And after that, I moved to New York, and I've been in practice as a family medicine physician for over 10 years now.
And how long have you been doing weight loss treatment?
So weight loss specifically, probably about 7 to 8 years.
Well, I think unfortunately in American society, about 2/3 of our public tends to be overweight. So I think you're doing something really good for society, doctor.
Yes, I would hope so. We're definitely helping manage diabetes, cholesterol, improve, cardiovascular outcomes. We're hopefully creating a healthier population.
God willing. So why did you want to make weight loss therapy one of your specialties?
As a family medicine doctor, when I first moved to New York, I actually worked in the Bronx, and I worked in community health. So most of my patients were diabetic, had hypertension, high cholesterol, probably also had COPD or asthma. And specifically for like my diabetic patients, I would always tell them, yes, you need to lose weight. That's going to be how we're going to help control your diabetes. And the patients with cholesterol and with high blood pressure. And so eventually I realized that a lot, like the common denominator in all of those chronic illnesses, even arthritis, was being overweight and having obesity. And back then, when patients would come to me and say, hey, doctor, how do I lose weight? I'm like, well, calories in, calories out. You just have to cut your calories and you have to exercise and go on a treadmill. And that was sort of like all I had to give them. And I would have patients tell me that they were doing everything they could possibly. They were barely eating, they were trying, and they still had a lot of difficulty losing weight. And that was around the time when they started promoting Victoza. So a lot of the medical reps would come in and say, hey, prescribe this medication for your diabetic patients. They're going to lose some weight. And back then I remember thinking, I'm not going to be prescribing something just because they're going to lose a few pounds. I'm going to prescribe something because it's appropriate. The joke was on me because now here I am prescribing all the GLP-1s. But that is sort of how I decided to really figure out how to manage weight and obesity as a condition rather than seeing it as sort of one of those things that needed to be fixed so that I could help their diabetes or hypertension.